Is there anybody who's new? This is their first time? Okay. I'm Chris Bovos. I'm the bariatric coordinator for the program. And what we usually do at our support groups is we talk about something that's of interest, some topic, and then we get into small groups afterwards so that everybody can share where they're at in their journey, and people who are further along can help those who are newer from surgery or maybe haven't had surgery at all yet. But so I'm only going to talk for about 20-25 minutes, but let me know if you have any questions. I know one of the questions I get in class a lot is, I've heard that your hair falls out. And your hair doesn't fall out, you're not going to go bald, but you will have thinning of your hair after surgery. And that's what we're going to talk about. It's not something to panic over. Everybody experiences it to a different degree. It's temporary, and we're going to talk about some of the things you can do to help prevent that. At any given time, 90% of your hair is in a growth stage. And depending on where your hair is, it depends on how long it stays in that growth stage. Hair on the top of your head stays in it for years. Hair on other parts of your body may only grow and then fall out in a much shorter period of time. But most of your hairs are in that growing stage. A couple of percentages of your hair are in a transition phase where it goes into a resting pattern right before it falls out, and then the other 10% of your hairs are in a dormant phase, and then the new hair comes up underneath them and pushes that one out, and you have a new hair. Normally, just every day, normally people shed about 50 to 100 hairs every day. However, there is something called excessive shedding that occurs after surgery, and it's called telogen effluvium. And so what that means is a lot more of your hairs go into that stage where they're going to fall out. And that's when you start seeing this hair thin. And the reason that that happens is your body is trying to heal your stomach and the other parts of you and reconfigure your digestion, and it really doesn't care about your hair. You care about your hair, but your body wants to send all your nutrition down here to heal from surgery. So it takes all of that nutrition away and focuses it down there, and that's what causes the hair thinning. This is a hair life cycle. And as I said, all hair starts out in this anagen phase. And it stays in that for, like I said, it can be months, it can be years, just depends on where it is. And then once it goes into the resting stage, you'll see that it narrows and it starts to move up. And then when it moves into the telogen phase where it's going to fall out, then a new hair comes up underneath there and pushes that out. So what's happening when you're losing hair after surgery is you're almost bypassing this. These hairs convert to this, and they have to all fall out before they can go back to the anagen phase and start growing again. The resting phase normally takes about 2 to 3 weeks, and then when you get to the telogen phase, that takes about 3 to 4 months, which is why you don't have that hair loss right away after surgery. You start seeing it about 100 to 120 days after surgery. Then you'll start noticing that when you brush your hair, you're getting a whole lot of hair. Or when you wash your hair, it seems like there's way more hair coming out than had been. And that will normally resolve in a few months. If the follicles aren't damaged. So when I say 6 months, I mean from the beginning of that stage. So you should be 6 months out of surgery, your hair should be coming back in and doing better at that point in time. So it is a little disconcerting to women who already have real thin hair, because sometimes you can see part of the scalp, it gets so thin. but it will regrow as long as you continue getting enough of the nutrition that you need.
I have a question.
Yeah.
Does it change color?
No. Not to my knowledge. I don't recall anybody saying that it ever changed color.
Well, I mean, like, does it get gray?
Oh, no, not unless, not unless you're at a point where it's going to get gray anyway. No, it shouldn't change the color or the texture of your hair. I know things like chemotherapy do when patients lose hair from the medication, but that's because the follicles have been damaged, and so it doesn't just return to what it normally was. But as long as your hair follicles aren't damaged, there should not be any change in your color or the consistency of your hair. Most people who lose hair because it's a genetic hair loss, and if your parents had a lot of hair loss, you're going to have it too. But these are the things that can cause you to shift from that anagen phase into the telogen phase. Real high fevers, severe infections, sepsis, those kinds of things. Major surgery, which you are having with bariatric surgery. Chronic illness. A lot of our patients do have chronic illness already. Acute weight loss, certainly that's something we're hoping for. Anorexia, iron or zinc deficiency, childbirth. A lot of women lose a lot of hair when they give birth. And again, it goes through that same cycle. It's not usually as profound as it is after surgery, but a lot of people do lose it then. Acute physical trauma, hormonal disruption, major weight loss, low protein intake, heavy metal toxicity, and there are certain medications that make it a little worse. Things like your beta blocker, blood pressure medications. Yes?
When you say low protein, what would be low protein? It seems like different programs and different people kind of intake different amounts of protein, so I didn't know, is there a certain number that constitutes low?
You want to get in at least 60 grams of protein a day. A lot of people really don't need much more than 45 to 50. If you're relatively tiny, I know Laura could probably get by with like 45 grams of protein a day. And if you're really tall, I have some patients that are like 6'5", big boned, and those patients need a little more, but usually not more than 75. The problem is, if you take in more protein than you need, your body will convert that excess protein to carbohydrates. And we all know what carbohydrates do. They're just going to cause you to gain weight. They're going to be converted to glycogen and get stored in your liver. So you don't want to overdo the protein. And I know that there's things that you read out there on the internet, and you have to be really careful. We follow the guidelines from the American Society of Metabolic and Bariatric Surgery. And that's all based on hard research and evidence, and not all programs are based on that. If they're not accredited, it's whatever they decide to do. But excess protein isn't necessarily going to help you. The people that need more protein are your athletes who are building muscle, or your bodybuilders. They will eat more protein because they're trying to put on muscle, because all your muscles are basically made from protein. So if you were going to run a marathon, you'd want to bulk up and eat some more protein. But for a regular person, you don't want to overdo the protein. If you get 60 to 70 grams of protein a day, you're fine.
Thank you.
So once you go through one of these, and you're going through several of these things that cause hair loss, you will find that that hair has to fall out before you can then go back and regrow it. You can't take anything, eat anything to switch it back into that anagen phase any sooner. It has to go through that timed process. So it's going to take, like I said, about 100 to 120 days after surgery, and then it's going to take about 3 months before you start to see that hair grow back in. One of the things that you can look at is if you look at the root of that hair that's coming out, if it's a bulb shaped, then you know that that's the result of the surgery. That's the telogen effluvium. And that's a good way to know that that's what you're going through. Once you start seeing them without this, then it's just your normal hair loss. Okay. Let's see. There is some hair loss that is due to poor nutrition. So anybody who has hair loss that goes on for more than a year, any that starts more than 6 months after surgery, can be the result of poor nutrition. If you're not eating enough protein, if you're not taking your vitamins and your calcium, you can find that you have prolonged hair loss. If you're losing weight incredibly rapidly, I have some people where it just seems like they lose it so quickly, and so sometimes those people don't have quite as good nutrition because they're so busy losing weight, it's hard for them to keep up with their nutrition. So you may see a little more hair loss with that. Patients who have difficulty eating, some patients develop strictures, some people will have trouble with vomiting or something after surgery. If that happens and your nutritional state gets depleted, that can create more problems after surgery and extend that. And if you have low values of ferritin, zinc, or protein, that can cause it. And if you have other symptoms of a deficiency, hair loss isn't the only thing that people that are deficient in certain vitamins will find. I know a lot of people talk about taking biotin to prevent or to help with hair loss. And the main symptom of a biotin deficiency is a dermatitis, a skin condition. So if you're not seeing other signs, then you probably don't have a deficiency in that particular vitamin.
What's ferritin?
I'm just going to talk about that. Iron is the nutrient that you most often see correlated with hair loss. That goes on beyond that time. And there's a lot of different lab values for your iron, and the one that refers to your iron stores is ferritin, and that's the one that we need to look at. There's your iron binding capacity, your total iron binding capacity, but your ferritin level is what we look at because that's where your iron stores are. And when those become depleted, then your iron is low, and that can lead to extended hair loss. We don't really have that optimal level defined by science yet, but most of the evidence says that if your ferritin level drops below 40 micrograms, then that will affect your hair loss. And the problem is 40 micrograms of ferritin is not what our most physicians think is anemia. They don't see that as low. But so you want to ask them, and if you're not getting your lab work done here, you're getting it done by your primary care, you want to have that ferritin level checked. And if it is below 40 micrograms, then you want to have a conversation with your doctor about iron, because you may need a little bit. A lot of our patients are iron deficient, yes.
The blood tests we get taken here, they do check that and all these things, correct?
Yes, yes.
So we'll know.
But if you're having it done at your primary care, then you can just ask them to please check your ferritin level.
My question was, so Dr. Serrani said I had that it was low.
Okay.
And to start taking an iron pill. Well, then when I went to CVS, it seemed like there were two types of dosages, one that was like 27 something, and then there was one that was higher. And I wasn't really sure. Since
Oh, he didn't
tell
tell
me-
you how much to take?
No.
Like the supplement's supposed to be like 35 or less.
And since I'm fighting constipation, I was like, I had heard that I was nervous to get the larger dosage, so.
I don't blame you. Now, if you're taking our vitamins, and you're taking 2 of them a day, you should be getting 45 milligrams of iron in those. So it may be that you're not absorbing the iron as much. And it depends on where you are in your diet progression. If you're not at the point where you're eating a lot of meat, sometimes that can cause people to be a little iron deficient. But I would start with the lowest dose, especially if you're already dealing with constipation, because iron can really cause constipation, and you may want to. I usually tell people to get some Miralax and stir a spoonful into everything you drink to kind of keep things going, and that will sometimes help. But
Is there another vitamin to take with the iron to make the iron being absorbed?
The ones that come in our vitamins have all of that with them. Because one of the things that has to happen is the hydrochloric acid in your stomach has to digest the food, and it has to extract something called intrinsic factor. And that gets absorbed down in part of your small intestine. So that's why I say some people may not be absorbing it as well. And it may just be that you're at a point where you're not making enough acid yet to get to the point where your digestion is more normal, and that you can then start absorbing it better. But I would just start with the low dose, and then when you go back, you can recheck that.
Okay.
But did he say what it was? Did he tell you what your ferritin was?
If you did, I don't remember.
Okay. Okay, but if you're following up with Dr. Cerati for your lab work, he's very knowledgeable about all of that, and so he can check your ferritin levels. He's very on top of iron with patients. A lot of times other doctors don't notice that your iron stores are low and that you need iron, but he frequently is checking that, and he can give IV iron infusions in an outpatient setting if it gets bad enough and that's required to get your iron stores up. So as I said, a lot of people who are in that effluvium stage where they're really having a lot of excessive shedding respond very nicely to iron infusions. So just keep that in mind down the road, and if you're wondering about it or your hair loss has gone on longer than you expected, check with Dr. Cerati. He's more knowledgeable about it than the surgeons are. They know their side of it. They can do your expert surgery, but sometimes when it comes to the medical side of things, they leave that to Dr. Cerati because that's his area of expertise. Another thing that has been linked to hair loss is zinc deficiency. And that's not real conclusive, so I don't like to tell people to go out and get a zinc supplement. Again, there's enough zinc in the vitamins, and too much zinc can be toxic and really cause a lot of symptoms in your GI system. So you don't want to overdo. The upper level of intake should be 40 milligrams. And you have to have a test for that because it has to stay in balance with your copper levels. And our vitamins, I believe, give you 30 milligrams of zinc. So that is something to consider. And foods that are high in zinc are oysters. That's probably not something many of our patients are eating. Beef and lamb, toasted wheat germ, spinach, pumpkin seeds, cashews, cocoa powder, pork and chicken, beans and mushroom. But oysters have like 12 times as much zinc as anything else. So sometimes a little bit of extra zinc is okay. And as I said, our vitamins contain 30 milligrams in those 2 capsules total. A low protein intake or poor digestion of your protein is also associated with hair loss. You need to eat high quality protein. You've all got a book that gives you a list of protein in there, and you want the highest quality protein that you can get. I'm always joking with patients, I'm sorry, hot dogs are not high quality protein. You need to bump it up a little. But your beans are a great source of protein. Quinoa is a great source of protein. So just make sure that you're getting your 60 milligrams and you're getting high quality protein. And hopefully a couple times a week you're eating some good fish because that's wonderful protein for you. Yes.
When you eat beans, do you need to like eat cheese or something like that to make it a complete protein, or do we concern ourselves?
You
with
can
that
eat,
complete protein?
actually, one of the best things to eat with beans is quinoa or some brown rice, because the brown rice has some of the essential amino acids and the beans have some of the essential amino acids, but you put them together and you now have a complete protein.
And is there any certain ratio you have to do, or just a little bit of quinoa with beans or something? Is that okay?
Honestly, that's a good question for Laura. I don't know. I do know that in a lot of cultures, rice and beans is a staple, and that's why, because they know that they have to eat those together to stay healthy. So, yes, if you're eating a lot of beans, you're going to need something else to go with it, and usually, I would say, a 1-to-1 mix of them would be fine. So, a cup of beans, a cup of rice, I think would be fine. But you can throw those in anything. You can throw beans in soups, you've got them in chili, and you can add some extra, you can always add some extra quinoa to soups. That's a real easy thing to add because it doesn't taste like anything. It takes on the flavor of whatever you cook it in. And it cooks in 15 minutes, so it's real easy to add to things. It increases your protein, and you can now you can either buy it in bulk or you can buy it in the little packages and microwave them. And that's real easy to do. There's also some, I just jumped down. You don't want to just be drinking your protein. You don't want to become dependent on your protein shakes. You should never have more than 1 protein shake a day after surgery once you're eating regular food, because liquid protein doesn't stay in your stomach. It's not going to help you to feel full for very long. You're going to be hungry. So you should only use a protein shake after surgery as a meal replacement, not as a supplement. Once you get through that first 8 weeks, then you only want to use it as a meal replacement, and you don't want more than 1 a day. You don't want to become dependent on liquid protein. Your pancreatic enzymes that aid in digestion when you have surgery are redirected to a lower part of your small intestine, and that can affect how you digest and absorb your protein. So until your enzymes figure out what your new route of digestion is, sometimes you may not be absorbing as much as you're eating. So, and that may be why you hear at some sites they say eat a lot more protein. If you're not absorbing that protein, then you want to figure out why. But we can see that very easily on your lab work, and you're going to get your lab work at your 2-month, your 6-month, and then your 12-month, and then once a year we're going to be checking that. So we can always check and see where your protein levels are. There has been some speculation that the amino acid L-lysine contributes to hair loss, and that adding a little bit of that can help. It does seem to help to increase your ferritin levels, so that may be why that works. So you might look, if you're looking at supplements with amino acids, that's one you might want to check. Cindy told me when she came in that her hair is doing fine since she started her biotin, so here I have a slide that says, no, that doesn't work.
That's okay.
But there's no science behind it. There's no science to say that taking biotin helps. So that being said, I have a lot of people that swear by it, so I'm not going to rule it out. If it works for you, good. It is nothing more than a B vitamin. You can't overdose on biotin. You can take as much as you want. It is one of the main ingredients in the supplement called Hair, Skin, and Nails. And that is just fine to take. They even sell it in the pharmacy next door in gummies, and I think they're only 15 calories per gummy. But if that works for you, far be it from me to say, you know, that may not work for everybody. I just know that the science isn't there, but sometimes your anecdotal science is just as good. So if you had a true biotin deficiency, as I said, you'd have a skin condition or some dermatitis along with that. It's extremely rare to have a biotin deficiency because so much of what we eat is now fortified with your B vitamins. All your cereal is, and so those kinds of things really do keep your vitamin B levels up. As I said, the hair thinning is temporary. You'll begin to see it start at 3 to 4 months. It will continue for probably 3 to 4 months, and then it should regrow. But if it goes on longer than 6 months, then we really do need to check your lab values. If you have difficulty eating, if you have more rapid weight loss than expected, or you're not getting enough of those vitamins and minerals, then we will check that, and we may need to bump those up. I have done a lot of research on this because my son, whose father has a full head of hair, is losing his hair at the age of 32, and unfortunately my father was bald, so that's why he's going bald. It's all genetic, but he's tried everything, and he's kind of just given up and accepted the fact that he's not going to have his father's head of hair. He was very disappointed. But your omega-3 fatty acids, which are in your salmon, tuna, mackerel, and your fatty fishes, are supposed to be very helpful. So make sure you're getting enough of your omega-3s. And as I said, some people say that hair, skin, and nails preparation is very helpful, and you can buy that in almost any drugstore. I do have some patients who have used Keranique. It's a brand of shampoo and conditioner, and they say that that's very helpful. I don't know if it just makes your hair seem fuller and therefore you feel like you've got more hair, or if it's actually helped. Oh, have you used it?
The nioxin is the other one.
Oh, nioxin, yes,
That's the one I've
yes.
used for a long time. It really does.
It really does. Does it help regrow, or does it
It helps
just
regrow because I can see the little ones.
the little ones
Within
coming
2 minutes,
in?
it helps. My nails are really strong too.
Oh, okay. Oh, well,
Yeah, it's
good.
worth it.
Oh, good. I'm glad to know that. We've got,
You can read. I think you have to order that on the internet.
Keranique, I think so.
Yeah,
Nioxin you can buy at beauty
Beauty brand,
brands. Yeah, I've seen that there. Rogaine will stop it from thinning, but it won't regrow any hair. So if you're trying to regrow hair, don't waste your money because it's really expensive. And a lot of people are afraid to shampoo very vigorously because they're afraid that, you know, more hair will fall out, but that actually improves the circulation of your scalp, and that helps to promote hair growth. I don't know about this product. I've read a lot about it. People swear by it. They have supplements, which are expensive, and they have a shampoo and conditioner. I don't know too much about it, but one of the things that's in it is saw palmetto, which is a supplement that some people take for prostate or urinary tract issues. And there is some science showing that taking some saw palmetto does also help with that hair loss. So you might give that a try if that's something that you want to try. I don't know. I didn't see any toxic effects from taking too much of it, but that's just something that if you get too desperate, you can give it a try. But almost everybody will find that their hair will start to regrow as long as you're getting your protein in, you're taking your vitamins all the time, but come and get your lab work checked. Come for those follow-up appointments so we can see if you're deficient in any of the vitamins or minerals that you need. Any questions? That's probably more information you ever wanted about the hair on your head or any other body part. Yes?
If you are told that you're deficient in vitamins, like I'm deficient in iron, would it be a good idea if you're using product A to go ahead and switch to product B? Could it just be that your body's just not absorbing or playing well with whatever you're using? So if you're taking bariatric advantage, maybe you should try this and see if your labs get better, or?
You can, certainly. There's different kinds of iron preparations. There's iron fumarate, and there's I can't think of the different names of all the different iron preparations. And some people just they just don't absorb it very well, and they just have to go and get an iron infusion every so often. But yeah, it would be worth trying a different preparation. Absolutely. I mean, it's better than having to go get an iron infusion. Nobody wants to have to do that if you don't have to. Yes.
Well, with an iron infusion, like how often do you have to do that, or does it last a long time, or?
Yeah, they last for quite a while. Usually, they will give you several over the course of a month and get your iron stores up, and then keep an eye on them. It's not something you would do frequently. There's something that we do very intermittently, and but that's the easiest way to get iron absorbed in somebody who's really deficient in it. Any other questions? Okay, then let's get into some small groups, and